for you today, and a lot of great speakers that'll be joining us, and I do want to introduce them to you. So our first, well, these are not necessarily in any order per se, so let me just introduce everyone. So Sarah from the National Low Income Housing Coalition will be speaking and sharing with us. Steve Berg from the National Alliance to End Homelessness is with us. Lisa Coffman from the SNAP's office is joining us. Aaron Weaver from HUD's Office of Community Planning and Development is also with us today. Jasmine Hayes from USICH will be with us. And then Debbie Fox from NNEDV and myself, Jill Robertson from Collaborative Solutions, are on the call today. So thank you for joining us. Let me give you just a quick review of what we're going to be covering today. Sorry about that, trying to get to the slides to work there. So just a quick overview, just wanted to share a little bit about who's all involved with the call, and also our partnership, our federal consortium, the Domestic Violence and Housing Technical Assistance Group. We'll talk about that here in just a moment. We're going to highlight some of the partnerships that we have across various federal sectors during this pandemic and try to offer any support that we can to you today. We'll be reviewing and going through an overview of recent COVID-3 care housing investments and expansions. And we'll also be discussing federal initiatives and responses to address the safe housing needs for survivors. So I wanted to make sure that everybody knew who was involved with our consortium. So we have a lot of great federal partners that are involved: the Family Violence Prevention and Services Program, the Office of Violence Against Women, the Office of Victims of Crime, the Office of Special Needs through HUD, and USICH, the U.S. Interagency Council on Homelessness. Also, we have technical assistance providers that are involved with our consortium, and those are the National Alliance for Safe Housing, NASH, Collaborative Solutions, National Network to End Domestic Violence, NNEDV, the National Resource Center on Domestic Violence, the NRCDV, the National Sexual Violence Resource Center, NSVRC, and Corporation for Supportive Housing, CSH. It's now my pleasure to turn the baton over to Jasmine, and she's going to share a little bit with us about some things from USICH.
Great. Thanks so much, Jill. And good afternoon, everyone. Really pleased to be joining the discussion today. So again, Jasmine Hayes with the U.S. Interagency Council on Homelessness. As it relates to COVID-19 and homelessness, our agency is working in very close coordination with our federal partners as well as national organizations to ensure that we're getting resources and guidance out as quickly as possible to the field, so that on the ground you have the tools you need to be responding to the pandemic in real time, while also continuing to do the work of addressing the needs of survivors experiencing homelessness or seeking assistance. Let's see if I can get my slide to the next. There we go. I think just bear with us while we had there you go. All right, well, we're getting the next slide up. Just before we move into the content for today, I think it's helpful to contextualize it within a larger frame of cross-agency coordination. And we often talk about the importance of working across federal agencies, and then at the local level, how important it is to be working in coordination. But it's something that I think becomes elevated and is even more critical in times like this. And we know there's been a ton of guidance and messaging rolling out in response to COVID-19, including resources to address populations experiencing homelessness. And there's now this massive infusion of new federal funding, and you'll be hearing more about that in detail today from my co-presenters. But just wanted to give a little bit of a framework for how we're thinking about it at the federal level. So at USICH, we've been using the CDC frame of plan, act, and follow up to help organize ourselves, recognizing that right now we're focused primarily on that immediate need to act with urgency in response to the crisis that we are all dealing with. At the same time, we have these new resources that are coming online, including new HUD funding, which really presents an opportunity to fundamentally shift or change our efforts to end homelessness. So we want to encourage communities to be really strategic about how those expenditures are being applied against each funding source so that we can maximize those dollars and leverage as much as we can to be accomplished through these new multiple federal funding opportunities. So that means prioritizing how dollars are used to address the immediate needs in relation to COVID, and then think about how we build on those responses with the other funding, knowing that there will be more funding coming down the pike. So I think that would be the message that I would want to emphasize for today, is that as we are thinking about addressing the immediate need, we also want to be thinking a little longer term, because as we move through and get on the other side of this pandemic, we want to be able to be prepared to address the long-term needs of the populations that we're serving. And so with that, just to close out, I've included a few links. These are the sites that are being updated regularly with new guidance and tools to support service providers and communities. So that includes the CDC, USICH. We have a dedicated landing page that's pulling together federal resources. So we have resources from HUD, HHS, education, et cetera. And then we also have a link on our website to our regional coordinators, and those are going to be a great source of contact. They can help you facilitate some of those connections on the ground to partners that are essential in that coordinated community response. With that, I'm going to hand things back over to our next presenter and look forward to answering questions later on.
Okay, so this is Lisa. I don't know, can you hear me? Okay, great. So hello, everyone. This is Lisa Coffman, and I am a staff person at HUD's Office of Special Needs Assistance Programs. So it's an honor to be here today with my colleague, Erin Weaver, and we're going to talk a little bit about the resources that the SNAPS office is making available to our grantees during the pandemic. And then Erin is going to dive a little bit deeper into the mega waiver that we announced, so that those of you who are COC, Continuum of Care, and ESG, Emergency Solutions grant waiver, or grants, grantees, those of you who get those funding sources can kind of understand what the waiver can do for you and how you can access that. So I'm just going to talk very high level about our thinking right now and the ways that we're trying to be responsive to you all. Let's see, I don't know if I'm moving slides or it doesn't look like I am. Okay. Bear with us for 1 second. Okay, great. So we at SNAPS, the main message that we want to get to you all is that we understand right now that your #1 priority is responding to this pandemic. We are taking into the account the need for a COVID response when we're considering performance metrics and monitoring governance, future HUD monitoring, and the COC competition. We've had a lot of questions about what's going to happen with the fiscal year 2020 competition, and I don't have an answer for you right now. For those of you who are participating in our weekly office hours, you may have heard Norm Suchar say that also last week. He'll probably say it again this week in the call in a little bit, but we're really wanting you all to not think about or not have to worry about the COC application right now. We know that your immediate response right now is to make sure that the folks that you're serving in your programs are safe, that your staff is safe and healthy. So we're working with you all to make sure that right now we're prioritizing every effort around the COVID-19 response. So next slide, please. So just like Jasmine mentioned, HUD has a landing page for COCs and for homeless assistance providers. We are curating all of the material that are partners at USICH, at the Centers for Disease Control, at the VA, at HHS, at the National Healthcare for the Homeless. We have a great landing page where we're providing all of the information that we're gathering for the field into one place for you all, because we know that you're busy, we know that you have these day-to-day challenges, but we wanted to have a place where you could go and find resources. And we're also sending out a daily digest where we're lifting up important news, new information as we get it. So if you're not currently subscribed to the HUD listserv, I strongly suggest that you do so, because you'll get that daily digest from us each day with updated resources. And I do want to make a plug for the SNAPS office hours. If you haven't been participating in those, we're doing them every Friday from 2:30 p.m. to 4 p.m. Eastern. I think, is that, or is it 3? I'll have Aaron confirm that when he comes on. It's either 2:30 to 3 p.m. or 2:30 to 4 p.m. or 3 to 4 p.m. Eastern. But we're doing it every week. And the focus is information to get out to the field. We in the SNAPS office do an update. We also have our partners from the Centers for Disease and Prevention to come on and do an update. We also have our partners from the HUD VASH program serving veterans to come on and provide updates to the field as well. And then we also take questions. So it's a great opportunity for you to submit questions in real time and get them answered by SNAP staff. And I also want to put a plug in for the HUD Exchange Ask the Question portal. You'll see the information on the slide. And I'm not sure, but Jenny or Debbie or Joe can confirm. I think we are going to make these slides available at the end of the presentation, but the Ask a Question portal is also a great way to get your questions answered by I just got confirmation from Jasmine. Yes, the HUD office hours, thank you so much, are from 2:30 p.m. to 4 p.m. Eastern today. Thank you so much. But the HUD Exchange Ask a Question portal, you can submit your questions around COVID-19, around, am I able to do this? Can I use my grant fundings for this activity? We are really striving to get answers back to folks within 48 to 72 hours. So I strongly encourage you, if you are submitting questions to your field office, that's great, but you can also submit them to the HUD Exchange Ask the Question portal, because we're turning around answers pretty quickly. And then the next slide is just really lifting up all of the resources that I mentioned so that you'll have those at your fingertips, and the slides will be made available after this presentation. It's a great way to kind of keep track of all of the information that's out there, all of the tools that we're hoping to get to you all as you seek to be responsive in this pandemic. So I'm happy now to turn the presentation over to my colleague, Aaron Weaver, who's going to dive a little bit deeper into the waivers and what that means for ESG and COC grantees.
Thank you, Lisa, and thank you all for attending today. We have a lot of information to cover in a short amount of time, so I'm going to move pretty quick, but as Lisa mentioned, you are going to receive a copy of these slides. We also have, I want to put a plug in for a training on April 14th. If you go to hudexchange.info, you can register for that. That's going to be for all of the grantees, so please avail yourselves of that opportunity. This slide here really just goes over the CARES funding breakdown. I'm not going to dive too deeply into that. I know there's a lot of questions related to CARES. There is guidance forthcoming right now. The SNAPS office, the Office of Block Grant Assistance, everyone's working around the clock to try to get that guidance out quickly, and we hope to have it out soon. So as of right now, we won't be taking any questions specifically related to CARES regulations until that comes out. So with that, next slide, please. And you can just go on to the next one too, please. Perfect. On April 1st, HUD released the COVID-19 memorandum. No joke, I know, April Fool's Day. But the actual effective date of that memo is March 31st. So whenever you see in the memo 6 months from the date of this memorandum, you need to date that to March 31st, even though it was not published until April 1st. It covers COC, ESG, HOPWA programs, as well as consolidated plan requirements for all of CPD's programs. And really, the goal here with the memorandum, as you'll see, we want to provide as much flexibility as we can to you, our grantees, for your response that's COVID related. So make sure that anytime you're viewing these waivers, it's through the lens of your COVID-19 response. Next slide, please. This is just a brief overview of how you would utilize the waiver. We are not asking you to request the waiver, the use of the waiver, and then wait for approval from HUD. Instead, we've created an expedited process where you simply notify the field office, and there are a list of specific email addresses that are to be utilized. I would also recommend that you CC your local HUD representative and the director of the local HUD field office. And you want to do so 2 days in advance of when you plan to utilize the waiver. Again, you're just notifying us. There are specific provisions that you must include in your notification, and those are outlined in the memorandum attachment. Next slide, please. One last thing that I forgot to mention just briefly, and you'll note this throughout the presentation, we want to make sure that you are documenting the reason, the justification for your use of the waiver. So while you don't have to request approval from HUD, you do have to maintain documentation on site proving why you needed to utilize the waiver for that specific instance. And in order to do so, we highly recommend that you develop a set of emergency record-keeping protocols and policies and procedures for implementation of the waiver. We are working on a set of those that we'll be able to distribute to you, because we recognize on one hand saying we're giving you lots of flexibility, and on the other we're asking you to develop policies and procedures specifically related to them is a bit difficult in this time. So again, as Lisa said, we're really trying to develop tools that will help you through this response. Next slide, please. And these are the COC program waivers. There are 7, and we're going to go through them in relatively quick succession. 2 notes related to documentation. I know a lot of grantees are concerned, what do I need to maintain on site? You have to think of documentation in 2 levels. One is at the grantee level, right? And that would be your policies and procedures and any macro level items as to why you are utilizing the waiver. And then in each client file for those affected, we highly recommend that you maintain specific documentation in there, a note to file stating that this client utilized this waiver at this date. Those are the important items to maintain, as well as when you notified HUD, so a record of that. We'll move on to the next slide, please. So the first waiver has to do with FMR. Currently, we are providing you with a 6-month waiver beginning on the date of the memorandum, and as I said, that's March 31st. And that allows you to exceed FMR for leases that are executed during this time period. We'll move on to the next slide. Disability documentation for PSH projects. We are providing a 6-month waiver to allow you to collect self-certifications of disability documentation. We recognize that with staffing levels and with shelter-in-place orders, or in our case here in Chicago, we've got Mayor Lightfoot on every street corner making sure that nobody is going out of their house. We want to make sure that you can still collect the documentation and house people. So an email from a client or a handwritten note, a picture of that's sent to you digitally. With all of this documentation, you can maintain it digitally on site, but I highly recommend you maintain a backup copy to meet your record-keeping requirements. Move on to the next slide, please. Limit on eligible housing search and counseling services. This allows you to pay for utility and rental arrears up to 6 months for each program participant, and this waiver applies for 1 year beginning on the date of the memorandum. This is to allow you to identify to alleviate situations where you cannot find housing for a person because of these rental arrears. So if you have a client that's currently housed, it wouldn't necessarily apply. You have to document that these arrears are making it difficult for the client to obtain housing. Next slide, please. Rapid rehousing monthly case management requirement. We are giving you a 2-month grace period on this, a waiver. We recognize, you'll note that this is a smaller time frame than some of the other waivers outlined in the memorandum, and that's because even though you do have your constraints on staffing levels, shelter in place, as I mentioned, we also recognize that right now our clients are extremely vulnerable for any number of reasons. The additional stress and strain of all of this means that they may need more case management at this time. Questions related to this that we've received are, can I provide case management over the phone to clients? This should be outlined in your policies and procedures, but that is a way that you could provide case management. So please try to limit your utilization of these types of things whenever possible, so that way you're meeting the needs of the clients. Move on to the next slide, please. Housing quality standards. This one is a bit more nuanced, so I want to make sure to point out that while we are providing you a 6-month grace period on the HQS standards, it doesn't mean that you don't have to conduct an inspection. You still have to conduct a visual inspection, and we ask that you do so over video or some sort of live streaming thing. If you are in a rural area, I come from rural Ohio, the cell service is very difficult in those spots. You can document this through pictures that are dated or a video recording. It doesn't have to be a live stream. It can be a video recording, but you need to make sure that there is a date somehow attached to it, either a verbal acknowledgement of the date or a date stamp within the video. We highly recommend that. And once the crisis abates, you have 3 months after health officials have determined that no special measures are necessary to then go back and conduct an in-person assessment of the property. Another thing to note here, for those units where lead-based paint might be a concern, we highly recommend that you prioritize those units to be inspected first once that 3-month period has ended. Next slide, please. Reinspection of units. For this one, we are providing you a 1-year waiver, so you do not have to conduct HQS re-inspections of units. So the first waiver had to do with initial inspections for client move-in. This is for re-inspection, so make sure that you document the difference between those two. Next slide, please. The 1-year lease requirement is waived for 6 months, so long as the lease is at minimum 1 month in duration. Next slide, please. So the ESG program has 4 waivers attached to it. Next slide, please. The first one allows you, any recipient that is receiving ESG funds may use those funds in order to upgrade or update the HMIS system to better accommodate COVID-related items. So before it was limited to just the ESG recipient if they were the HMIS lead. Now it is any recipient. Next slide, please. Reevaluation of homelessness prevention assistance. You have a 2-year waiver on this beginning on the date of the memorandum, so long as you conduct these reassessments not less than once every 6 months. Next slide, please. Housing stability case management. Again, here we're providing you a 2-month period, 2-month waiver to account for those difficulties you may have in providing this, but we really want to stress the importance of maintaining as much case management as possible with your clients during this time to help them cope with the situation. Next slide, please. FMR, similar to the COC program, we are giving you a 6-month waiver on fair market rent related to ESG recipients. You must, one last thing, and I can't recall if I mentioned this under COC, but in any case where we are providing an FMR waiver, you must still conduct a rent reasonableness assessment of the unit. And you need to make sure that you document that in the client file. You're still doing rent reasonableness, but you may exceed fair market rent. Next slide, please. I'm going to go over these hop wall. I know we're kind of focusing mainly on COC and ESG, but I want to cover all the waivers real quick. So we'll go through the HOPWA program ones just briefly. One thing to mention with the HOPWA program waivers is that this population has an increased risk of COVID-19. We want to recognize that, and so you'll note that rather than saying simply 6 months from the date of this memorandum, what we are saying is that you should defer to local public health officials. So the waivers will actually say 3 months after a local public health official has determined that it is safe to do so. So next slide, please. 4 waivers associated with this program. And for those of you who may be looking at the numbers in the boxes there and noting that there are a few waivers missing, we kept, for your reference purposes, the numbers refer to the number of the waiver in the memorandum. So I didn't present them in the exact same order they're in the memorandum. They are all incorporated here, but that's why the numbers might not sync up. Next slide, please. So with HOPWA, self-certification of income and HIV status, this is similar to the disability documentation waiver that we've provided, but again, note that it is based 3 months after public health officials have determined no special measures are necessary. Next slide, please. FMR rent standard, again, you may exceed FMR. There were already certain flexibilities under the HOPWA program to do so. And for those of you who may be thinking, well, wait a minute, we use a rent standard. Yes, under HOPWA, there is a unique provision where you can develop your own rent standard that is tied to the FMR standard. So in this case, we're saying that you may provide a revised rent standard during this time. Next slide, please. Property standards for tenant-based rental assistance, a 1-year waiver on this, similar to the HQS waivers that you've seen before. You still must still visually inspect the unit using technology, and you must ensure that after the crisis abates, you go back and conduct an in-person inspection. One last note on this, for those of you who are utilizing ESG funds, we've received a lot of questions about folks saying, well, wait a minute, you've provided a waiver under HOPWA and COC for HQS. Why haven't you provided a similar waiver under ESG? And that's because the ESG program utilizes habitability standards, not housing quality standards. The difference is that housing quality standards require in the regulations that you conduct an in-person inspection, whereas the habitability standards under ESG do not. There are other differences, mainly related to fire safety, but really the crux of it is that you do not have to conduct an in-person inspection under the ESG habitability standards. So please avail yourselves of that flexibility, maintain documentation related to visual inspections conducted electronically, and so on and so forth. Next slide, please. Space and security. This is primarily designed to allow HOPWA grantees to provide temporary quarantine space for clients that may need to be housed in a hotel or a motel. And for any of you who've been on the HOPWA office hours calls, they've been fantastic. And one of the things that they covered early on is so long as you have a leasing line item in your grant agreement, you can use that money to quarantine clients in hotels or motel space. Next slide, please. The last 2 waivers that we're going to go over have to do with consolidated plan waivers. These are going to be especially applicable to the ESG grantees and the CDBG grantees, so entitlement grantees, but ESG here, your local entitlement jurisdiction is going to possibly need to amend their consolidated plan in order to provide you additional flexibility, maybe an expansion of rapid rehousing or some other additional item that wasn't initially included in the con plan. That's what these waivers are geared towards. So next slide, please. The first one has to do with the citizen comment period. We are allowing you to shorten that time period. It's currently 30 days under the regulations. You can knock that down to 5 days for a substantial amendment. And the next slide, please. The second waiver has to do with opportunity for comment. So this is supposed to be documented in your citizen participation plan, which then feeds into how you conduct your substantial amendment process. And we are allowing local municipalities to determine what constitutes a reasonable notice and opportunity to comment given their circumstances. This means that in many cases, you're going to have grantees that are conducting public hearings electronically. So you want to make sure that you take advantage of those opportunities and those flexibilities. That was a very rapid fire run through of all of the waivers. So I hope that's helpful. If there's any questions, please submit them to the chat box, and I'll pass it off to the next person.
Sorry, just trying to get off the mute button. Thank you. This is Saadian. I'm with National Low-Income Housing Coalition. I'm going to talk to you a little bit about the resources that are in the CARES Act, although our previous speakers have really gone into great detail about that too, and spend a little time about what we're hearing about what's needed for the next package moving in front of Congress. So to start off, a little bit more about what's in the CARES Act. This is the bill that passed about more than $2 trillion in direct spending, including about $12 billion in HUD resources. We're really happy to see that our champions on the Hill have pushed really hard to make sure that we have the $4 billion in ESG grants, $5 billion in community development block grants, and other program levels for HUD vouchers, PBRA, public housing, tribal housing, HOPWA, Section 202, and 811. We know that this is not enough money to cover all of the needs, and so there are still efforts and communications going on with members of Congress about making sure that we fill in the gaps in terms of what is needed in the next package. To give you a sense of some of the other provisions in the bill beyond HUD that can be helpful and important to you guys, there were provisions extending or providing moratoriums on evictions and foreclosures. For example, there is a 120-day moratorium on filings for evictions in renters and homes covered by the federal government, and that's a very broad definition. So it includes both residents of HUD housing, USDA, or low-income housing tax credit development, as well as renters in homes that are covered by FHA, Fannie Mae, and Freddie Mac. We're already hearing that there's some difficulty in renters learning whether or not the property that they live in is covered by those entities, and we're trying to work with FHFA and with others to make that information more publicly available. I will say that when it comes to the CARES Act, looking at the next bill, we're trying to push for a more uniform approach to evictions and foreclosures. We know that many cities and states have been passing their own rules, and that can be kind of confusing, even though we really appreciate those cities and states stepping up to do that. We want to make sure that there's a uniform minimum protection for renters through moratoriums. I'll also point out that there are other resources that are made available beyond HUD that might be helpful to you. One includes the Coronavirus Relief Fund, which is a $150 billion fund provided to state, tribal, and local governments to cover any necessary expenditures due to coronavirus. So it's extremely broadly written. The money is divided up within the first 30 days, should be going out to states with a minimum state guarantee of $1.25 billion. We expect that there's going to be lots of demands on these funds, but a possible use of these dollars are addressing the needs of people experiencing homelessness or low-income renters. So that's another resource that you might want to think about engaging your state government with now. I'm sure they're putting together those plans, and we're talking to our partners at the National League of Cities and the mayors and CEOs for U.S. housing investments to talk about how we can be encouraging state officials to be thinking about housing and homelessness as a potential use of those funds. I'll also say that there were additional resources provided through the FEMA Disaster Relief Fund. There are a bunch of different programs that are available, whether your state is covered by the President's National Emergency Declaration, or if your state has requested a major disaster declaration. We have information to get into the more specifics of that, but what we think is the major use of resources for FEMA at this time are their public assistance grants for Category B, which is a long way of saying that there are resources that might be available for shelter and shelter providers. Given our experience working with FEMA, if you're interested in looking into this, we suggest that you work with your local emergency management office or your state governor for the planning the use of these funds. In large part, that's because dollars are required to be spent first by the local entity and then reimbursed later, and that can be very difficult for entities other than government officials. I'll also say that when it comes to the CARES Act, CARES 2.0 is what they're calling it. There's an understanding, especially among House Democrats, about wanting to see another very large-scale response to coronavirus. There is, in the meantime, a much smaller bill that's being negotiated right now that aims to fix some holes that were left in the first CARES package. This will mostly be focused on small business loans, and it may be hazard pay for frontline workers. We've weighed in with offices to make sure that people who are working in shelters are also included as frontline workers so that they might be eligible for that hazard pay as well. The details of that are very unclear, but one of the things that's really been hampering Congress has been the fact that they're not in DC, and it's very unclear when they'll come back. Because folks are not in town, that means that the only bills that can pass in the meantime are those that can pass with unanimous support. And so larger scale, broader packages that require negotiating or back and forth, that is something that we think is unlikely to happen until Congress returns. For that larger package, we are talking to our local partners and talking to our national partners about what is needed to respond to the needs on the ground. I'll say that I'll go through just a couple of our top line priorities of what we think is needed most. We know that for the CARES Act, for example, $4 billion in ESG funds were provided, but far more is needed. There was research from the University of Pennsylvania, UCLA, and Boston University that found that $15.5 billion is really needed to allow for shelters to practice social distancing, to acquire additional space, to use hotels, et cetera, to allow for isolation and self-quarantining, as well as to provide short-term assistance, rental assistance, and housing stabilization services to people experiencing homelessness. So $15.5 billion is needed, $4 billion was provided. That leaves another $11.5 billion that's still outstanding. And while we think there's some possibility of using CDBG funds or coronavirus relief funds or FEMA dollars for that, we know that there's going to be a lot of demands on those other resources. And so having something that's specific towards the homeless population is really important to have. The second piece of what we're pushing for, I mentioned a little earlier, is a uniform standard when it comes to moratoriums on evictions and foreclosures. We know that our people who are shelters are overwhelmed. There's so much work to be done. The last thing we really need is for more people to be experiencing housing instability and to potentially get pushed into homelessness. And so we are working on this sort of stopgap measure to keep people in their home for the time being. And then lastly, we know that even moratoriums aren't enough on its own, that in many ways that helps protect people, renters now, but if they face a financial cliff of having to pay back rent when the eviction moratoriums are lifted, we could just be postponing evictions rather than addressing them. And so we've done research that shows that $100 billion would be needed to provide assistance to all cost-burdened, extremely low-income and very low-income households. We are talking to members of Congress about providing $100 billion or so in emergency rental assistance, although there is some conversation that maybe more funds are needed to address that need. I will say it's very unclear about when or if this sort of a package would be moving. What we've heard is that while Democrats are eager to move very quickly, Republicans are a little bit weary of that. Having just passed a $2 trillion package, many of them want to see how those dollars start flowing into the economy before Congress takes another look at what needs to happen. So there's still a lot of uncertainty about what sorts of resources might be on the horizon. And I'll turn that over.
All right, hi, this is Steve Berg from the National Alliance to End Homelessness. And I'm gonna go through in a little more detail the ESG funding from the CARES Act, the $4 billion really designed to deal with homelessness very directly, and talk in some detail about what's in the law and what the process is as far as we know about it yet. So next slide, please. So the CARES Act funding, the $4 billion specifically on homelessness, goes through the ESG program, the Emergency Solutions Grants. If people are familiar with that program, it's a formula grant that's administered by the Special Needs Assistance Programs Office at HUD. It's one of the two large homeless programs that HUD. The other, which is much larger, is the Continuum of Care, but the Emergency Solutions Grant in a normal year is around $280 million. It goes out by formula. Larger or medium-sized cities and counties get their own grants. And then there's, in every state, a balance of state grant that's intended to cover the rest of the state. Most of the money in normal circumstances is subcontracted to nonprofit organizations. It's used for outreach, it's used for homeless shelters, it's used for rapidly rehousing of homeless people. It can be used for construction and operating costs of shelters. And it's also used for homelessness prevention. So people get help from this program, even if they're not homeless, if they're considered to be at risk of homelessness. Okay, next slide. So there are some changes to that in the CARES Act, some differences between the ESG that's provided in the CARES Act and the way it usually works. And let me, so the first thing is just a lot more money. I mean, we saw the ESG program usually is $280 million total. And it's, in most communities, an important but small part of what the community's approach is to homelessness. And this is going to be much larger. The law that provided it says up to $2 billion should be released on a shorter time frame using the existing ESG formula, and then the rest of it under a new formula that HUD is in the process of developing now, that will be more specifically designed to meet the needs of communities arising from the coronavirus crisis. As people know, HUD has already announced the first $1 billion in allocations. That again is distributed under the old ESG formula. So people can look on the website, HUD website, and see how much their community is getting. The rest of the allocations, as you heard people say earlier in this webinar, will be released soon. And I know people at HUD are working very, very hard to get this money out the door as quickly as possible. So we all have great confidence that they're going to do that in a good way. But the first $1 billion is sort of been announced. People have not yet received the money, so there's no place to go in your community to get the money quite yet. In general, the ESG program is administered by the state and local. There's usually a community development department within the state or within the local government. Sometimes it's a housing department. Those will probably be, in most places, those will be the places that the mayors and governors look to organize the use of this money and decide what to do with it. And those are people at the local level that everyone who works with any kind of population that's at risk of losing housing should be talking to already. Okay, next slide. Okay, and then there's some other details we know. Again, we can't speak too authoritatively about details until the money's actually released and HUD comes out with the guidance about how to use the money. That will provide all the details, but just some general things that we know from what Congress put in the law. I would say the following. One, there's no matching requirement. Usually under ESG, there's a matching requirement. There's no matching requirements in the HUD funds, in the ESG funds in the CARES Act. There's no shelter cap usually for ESG. Only up to a certain amount of the allocation can be used for homeless shelters, and the rest is used for either rapid rehousing or prevention activities. In this allocation, there's no shelter cap. If a community wants to use the whole thing for homeless shelters, they can do that. Or if they want to use none of it for homeless shelters, they can do that too. So there's more flexibility there. In the normal course of business, ESG can be used for prevention activities for people at risk of homelessness. The definition of who's at risk of homelessness is somewhat complex. The CARES Act provides that anyone whose income is under 50% of area median will be considered at risk of homelessness. So that's a simpler criterion, and hopefully will be a simpler thing for people to document. So that's part of the law. And then the law is very specific that there can't be treatment or performance requirements imposed on people in order to get help. This is the sort of housing first argument people may have heard about. And Congress is quite clear that the recipients of the assistance, the people who actually need the homeless shelters or need the homelessness prevention assistance, can't be required to participate to receive certain kinds of health care or participate in certain kinds of activities in order to get this. Next slide, please. So at the Alliance, again, we're in the process of putting out all kinds of materials that you can find on our website, working with other people on this call and elsewhere, about what communities can be doing with this money and what the best uses of it would be. So I won't go into a lot of detail here, but just say that some of the things that are important is expanding shelters and deconcentration of shelters so that shelters can comply with CDC guidelines about people having a certain amount of space. Providing non-congregate shelters has been an important part of what a lot of communities are doing. A number of different communities, for example, are using hotel rooms, many of which are vacant because of the virus. They're using hotel rooms to provide sort of secluded space for people who are particularly at risk of bad outcomes if they get the coronavirus. The ESG money can be used for supportive services to help people connect with permanent housing. It can't be used for a permanent rent subsidy. That's not an allowable use under ESG, but it can be used to help connect people with housing, to do landlord outreach, to help get people who are homeless now or who are in danger of losing or have in various kinds of housing situations that are not very stable, to help get them into into a permanent housing situation. And it can be used for rental assistance up to 2 years. So this can be used either for prevention or for a rapid rehousing kind of situation. Some communities are thinking about using it as sort of a bridge to a longer term housing subsidy for people who are going to need a Section 8 voucher. But there's a lot of things that can be used for. And again, the details should await the HUD guidance, but just as a general idea, this is what ESG has proven to be very useful for in a number of communities. So let me stop there and turn it over. This is me. If you have more questions.
All right, thank you, Steve, and thanks. I just really want to thank our federal partners, Jasmine and Lisa and Aaron at HUD and USICH, and thanks to Steve and Sarah at NLIHC and NAH. Just everyone's just doing an amazing job. Just doing lots of great work on the Hill, getting more resources and housing for folks, so we can be sending that out to the field and getting you all the resources you need for survivors at this time. So I just wanted to do a quick overview. We just have about 8 minutes left. I see there's chats and questions happening in the box. We won't have as much time for Q&A at the end. So if you do have questions, now is the time. Just put them in the box and we can respond to them there. But I did want to just do a quick overview of just reminding the work that we do in this field and grounding us in the work of being survivor-centered and trauma-informed, that this work that we've done around providing safe housing and providing mobile advocacy and doing housing for survivors is work that we've been doing for a long time, and that we are ready and we're able to do this work with these new resources as a result of all of the groundwork over the many years in the DV housing field. So with these new resources that you've heard about from our partners, our federal partners and national housing partners, there's a lot of flexibility around the funding, and there's some shifts around the oversight of the funding. So it's really an ability to match the values of our safe housing philosophy with also being able to provide flexible programming and financial assistance, and to be survivor driven and trauma informed. And I know we've been talking to a lot of you in the field that everyone's shifting models and looking at different models and moving survivors out of communal housing shelters and putting people into private dwellings. So we have a lot of this work that has been ingrained in what we're doing, but we're having to respond more quickly. And then also looking at when survivors are contacting us now, we have all been reading the articles, and I'm sure seen in social media, and just for those of you in the field, getting more requests for housing, and some of the concerns that we have, of course, that there's the public health response that we do need to be sheltering and staying home, but also that creates another public health issue in terms of safety for survivors in their homes. So we also want to make sure that the resources are responsive, that if survivors are calling you, that you're able to use housing resources to get people directly into housing and safety during this pandemic. So next slide, please. So I just also wanted to ground, this is a slide that we use in a lot of presentations. It's just about thinking about different types of responses and getting people into permanent housing quickly. We often have a shelter model in the DV field, but the shelter model now can include getting people directly into permanent housing situations and into resources with our FIPSA fund. So that would be the next slide. So there's been some clarity on FIPSA funding. There was a notice that went out to the field on March 31st from the Family Violence Prevention Services HHS office that was a frequently asked questions two-pager that really clarified for our field, for the domestic and sexual violence field, if FIPSA is allowable for the use of basic needs and rental assistance and hotel and motel types of supports for survivors. So it's very clear that it is. So there was an additional $45 million with the CARES Act, with the third package. And so we have additional resources from FIPSA. We don't know quite when they're going to go out. But hopefully we hear from the FIPS office that it'll be quickly and soon. And then that'll be going out to the field, and you'll be able to use it for those resources. And then we also will send out, post this webinar along with the slides and all the information. We'll do send a cheat sheet with all of the funding, different federal funding streams, also information about the FIPSA funding stream, and then in particular the FIPSA notice about the broad discretion with the usage of these funds. And then I also just wanted to remind folks that we also have other resources in the domestic and sexual violence field for housing related funding, and that the Victims of Crime Act, those funding streams are allowable for housing. So it'd be a great time to contact your VOCA administrator to ask about using that for housing related expenses if you're not currently doing that in your state. And then I just want to remind folks that we do have OVW, Violence Against Women Act, transitional housing funding, and that funding is for 6 to 24 months, so it's very expansive. If you have people currently in the program, we encourage eviction prevention and keeping people in the program and supporting them as they are getting on their feet. So people can stay in that program up to 24 months. And then we also, like Sarah was mentioning, there's a lot more requests going out with the CARES 2.0 package, and we will be asking for additional FIPSA dollars and additional OVW transitional housing dollars, along with supporting our national housing partners around the housing ask. And then I just wanted to do a quick reminder around the COC ESG funding that's going out, the $4 billion. Steve did an amazing overview of what that funding looks like. I just want to give a quick reminder that that funding also, it's Sexual Assault Awareness Month. That funding is expansive. The definition category 4 of homelessness is for fleeing domestic violence, sexual assault, stalking, or human trafficking. So I just want to make it really clear for sexual assault programs or dual domestic and sexual violence programs that funding is for sexual assault survivors as well. And the survivors can self-certify, and it's their definition of what they consider fleeing and life-threatening or dangerous in terms of their domestic violence and sexual violence that they've experienced. So that's also in terms of the definition of them being eligible for those funds is expansive. We have a couple more minutes. I want to turn it back over to Jill, but I just want to also be thinking about racial equity pieces and the LGBTQI community. There's a lot of information going out about cities, and our mayor here in DC recently just was talking about how disparities of the pandemic show the urgent need to address inequalities that are embedded in all aspects of our society. So that includes healthcare, housing. So this is not just a coronavirus issue, but this is a issue that's plagued our country for centuries. So, but I just want to say that just however we can get the resources to those who are most impacted and have the most disparities around corona, that we be thinking about that as we do the programmatic pieces of getting the housing out to those who need it. I think that's it. We have these weekly calls that we're setting up with the Deviant Housing Technical Assistance Consortium. And so we'll be doing these weekly and sending out reminders. And I just want to refer people to the Safe Housing Partnerships website and the National Alliance for Safe Housing website, and NNADB and HUD and everybody in NEH and LIHC. We all have really great resources. I know we're in kind of information overload right now during this time as well, but glad everyone could be on the call. And it's 2 on the dot. I'm passing it over to Jill. Thanks, everybody.
Thanks, Debbie. Just one quick thing to wrap up. If you do have any questions, please feel free to drop those in the chat. We'll try to get to those here momentarily. We will be sending the slides out. We have recorded the session as well, and we will make that available on the Safe Housing Partnership, hopefully as soon as Monday. That's probably as quick as we can get that up there, but we will get that to you as quickly as we can. The other thing I wanted to just mention is HUD is hosting a mega waiver office hours on Tuesday at 1:30 p.m. Eastern Standard Time. If you'd like to tune into that, if you have any questions around the mega waiver, we'd love to hear what your questions are and try to get those questions answered. So thanks, everybody. We'll try to, again, get your questions answered if you have any. I'm looking to see, it looks like we mostly have those answered. And just, again, want to thank everybody for joining us, presenters and participants. Thank you.